Hey, clinical psych folks. So this is going to walk you through the Gestalt case study of Louisa, who was a 35-year-old female. She was single. She had borderline personality disorder, which, as Dr. Blackman talked about, and as we've mentioned when we went over diagnoses, it's very severe disorder, often involves self-harm, lack of sense of identity, things along those lines. She also had severe bulimia, so binging and purging. Sometimes in borderline, that can serve as another form of self-harm. They kind of go together. Suicidal behavior, again, very common within the context of borderline PD. She was severely depressed, and she had avoidant and dependent traits, and she couldn't accept her identity. Again, very common, unfortunately, with people with borderline PD. Now, in terms of her personal and family mental health history, she thinks her parents wished she were a male, and she has previously been hospitalized. In terms of her social history, she was the second born of unplanned fraternal twins. So surprise to that family. She has few friends. She sees her animals as her family. She's never married, and she lives near her family and is not close to her brother. Now, in terms of duration of therapy, here's where, again, we'll see some similarities with traditional psychoanalysis. 3.5 years, 143 weekly sessions. And the techniques used here are the hot seat, confrontational. When you watch the video of Pearls doing Gestalt therapy with Gloria, you will see this illustrated. It is not comfortable in any way, shape, or form. Sharing of the therapist experience, in the moment, supportive. Her strengths are liking animals, and her emotions related to that, and she's willing to talk, and she does have some insight. Now, difficulties encountered during therapy, dissociating, again, very common for people with borderline PD. They often have a history of trauma, and so dissociating is an extreme form of zoning out, basically. So sometimes when you're working with someone who dissociates, you actually have to, during the session, bring them back to you. So come back to me, where were you, that type of thing. She also had panic attacks, which can be really problematic. She had a hard time seeing herself in a positive light. She thought she shouldn't exist, and she blamed things on others not taking responsibility. Now, in terms of effectiveness, she talked about a sense of aliveness, and the therapist talked about the therapist life improving that day. She went deep into her dark side, and she didn't hate her existence so much. So, like, that's positive, right? So that's just a very brief version of the case study of Louisa for you all.